Hi, everyone. It's Vrushangi Shah with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am thrilled to be joined by Alisa Raju MHA. Thank you for joining me on the podcast.
Thank you for having me. I'm looking forward to this.
Yeah, absolutely. So, as you know, the real goal of this podcast is to highlight fellows from across the country. And I am based off the West Coast, so I'm super excited to have someone all the way from the East Coast today. So, just to kick it off, can you tell me about your educational journey and kind of where you did your undergrad, what your degree was in, and also, where you got your master's from?
Yeah, sure. So I actually got my bachelor's from the University of Albany, so the SUNY school. I went originally to pursue a career as a physician assistant, and during that, I think it was like 3 years. I switched like my junior year. I realized like I wasn't passionate about patient care as much as I thought I was. I still wanted to help patients, but I had more of a mindset for leadership and business. And my sister actually told me about healthcare administration, and it was kind of like a combination of both. So I wanted to pursue that, and I switched like my junior year. Luckily, my major was in psychology, and I was a minor in business and biology. I was very confused, but it allowed me to be like a well-rounded student and also have a flexible degree. So I was able to switch my junior year and also still graduate on time. And while looking for programs, I thought Stony Brook was a great program. It was a little closer to home, and it was a SUNY school as well. So I did my MHA there. It's a 2 year program. And during that time, I learned more about healthcare administration and also about the social terms of health, which I really resonated with. That's something also my family dealt with growing up, which is why I wanted to pursue healthcare administration to be a healthcare leader that helps break barriers to care, especially for like immigrant families and just communities that are less, have less resources than most.
Yeah, absolutely. And what an incredible journey and to really highlight the social determinants of health. And, the funny thing is, I've had many guests, and the podcast has had many guests on. And so many of us discovered healthcare management after trying to go down a different route. And
Yeah.
oftentimes it is a healthcare route, right? Like I know
Yeah.
many people who were going to be who wanted to be doctors or, PAs or even physical therapists. And in going to classes, they realized that maybe this wasn't the right avenue, and that's how they discovered health management. So I appreciate you sharing that this wasn't like your first choice. You had the ability to kind of figure out your major before ending up in an MHA program. So that's great.
Yeah.
Um, and I saw so you worked at one of, in my opinion, such an incredible organization pretty early on in your career. We spoke about this. You worked at Memorial Sloan Kettering, and so tell us a little bit about that. What was that experience like? What was your role? What were some of the initiatives or projects that you took part in?
Yeah, sure. So at Memorial Sloan Kettering, I worked as a care coordinator, and it was my first full time job. So I thought it was a great organization to get my feet like wet, but also just get the experience I needed at an entry level. So I worked there originally as a care coordinator one. So it's basically just like front desk, check in, patient registration, scheduling, all that. And then within 6 months, that's a great thing about like Memorial Sloan Kettering. There's so much like professional growth. Within 6 months, I got promoted to a care coordinator too. And they assigned us to our own provider and we ran their clinic. And it was just a great way to, get to know more about the patients, but also the operations behind, running a clinic, like everything that goes into scheduling, the nurse that you work with, the doctor that you work with, learning about provider schedules, and it gave me a lot of exposure to the field, especially at entry level, and it
Mhm.
helped me get the experience that I needed for my fellowship. Actually,
Yeah, and I'm sure it was an incredible time. I work in cancer services, and we are always looking to best practices, and so many of them come from Sloan Kettering. So I'm so excited that you were able to get this experience so early on. And so, jumping into the topic of our fellowship, tell me about your fellowship and tell our listeners, was it one, well, actually, let's start with, why did you want to do a fellowship? What drew you to that process as opposed to just continuing on in your career?
Yeah, sure. So I remember during my master's, we did like mock interviews, and I always ask people about like their healthcare journey because, a lot of fields or like careers, it's kind of like one step after the other. But healthcare administration, you can go so many routes. So I always ask people like how they got to where they were because I'm actually the first person in my family to go to like a non like clinical role or like just like a normal grad school rather than like nursing school or med school. So I was really just navigating this on my own. And it's really hard when like no one else in your family or like is doing it or you don't have a lot of resources. So I remember like asking everyone how they got to where they were. And this one person I met, she actually said she did administrative fellowship. And I was like, oh, like what is that? Sounds so cool. And she just explained how it's like kind of like a training, but also you're learning, you're working, and it's like a stepping stone into healthcare like management. And a lot of people described it as like a couple of years of experience in one. And I was like, oh, that's so great, especially because after grad school, I wasn't really sure where I wanted to go or what I would do. And I thought a fellowship would be a great way to continue to learn about what healthcare administration has to offer, but also like learn what interests me, so I decided to pursue a fellowship. So I actually, in all transparency, I applied twice. So the first time around I applied, and I only applied to places in New York because I love New York and I love being home. Just being close to everyone. I was like brought up here, so I did want to stay close to home, but I didn't realize how competitive fellowships were, especially like New York is a great place to live, so everybody wanted to come to New York. And I didn't realize how popular it was because I just learned about administrative fellowships. I didn't know everyone knew about them. Um, so the first year, I applied to like around 10 fellowships, and all in New York. I got a couple of interviews, actually, no second round interviews, just a couple of first round interviews. And then I learned that I didn't get the fellowship. And originally, I
Mm.
kind of just like accepted it. And I was like, okay, now I'll just go like the traditional route. But I remember listening to actually another healthcare podcast, and they were just talking about how great health, like their administrative fellowship was. And it made me regret not being able to have that opportunity. So I remember thinking to myself, if doctors can apply for residencies, like again, like why can't I apply for a fellowship again? So I remember I spent that whole year just making myself more competitive. That's why I went towards like a full time job at Memorial Sloan Kettering. And then I also did an internship as part of my grad school program. I was on an e-board for like the future healthcare leaders of Stony Brook. And then I also became like a wedding planner and event coordinator. So I do that on the side. Yeah, so I did everything that I could just to make myself more compatible. And like, the wedding stuff, it was actually like so many transferable skills from healthcare management. And like that's my one piece of advice, like being able to take what you love, but also using transferable skills. Like there's so many other fields out there that have transferable skills. So I will say for applicants to try to leverage that and use that within their interviews. Because originally I was like, oh, like no one cares about that. But then, it's a lot of transferable skills. So I used that year to make myself more competitive. And then I spent the whole summer just really honing down on like reaching out to my resources, everyone that I knew that was a fellow, even, just random leaders that I knew to help myself get all the knowledge and like resources that I needed. I really honed in on my like personal statement. I interviewed a lot of like current fellows and like just got all the information I needed to be more competitive. Luckily, I got first round interviews and then I got a couple second round interviews, and I actually got like two offers. So I ended up going with Luminous Health, which was my last fellowship.
Yeah, how incredible. Okay, first of all, totally understand why you'd wanna live in New York. I've been to New York countless times, and I feel like when you're born or raised there, there is that, like, a true New Yorker wants to always go back to their roots, and so I totally understand that. And how cool that you have a wedding planning business. For definitely so many transferable skills in
Yeah.
that. I totally see it, and it's so funny. I always tell my family if I wasn't in health management, I think I would be a wedding planner. So I completely understand where you're coming from. How
Yeah.
cool. Um, but also, I want to commend you for the transparency and the honesty and being vulnerable with our listeners. I think people don't actually realize how competitive the fellowship process is. And I honestly want to give you kudos for trying again because I think a lot of people would assume that, oh, I didn't get it this time. I'm just gonna move on with my life and go down another path. And so I'm so it's so incredible your story, and I loved hearing that you tried again and you secured a fellowship. And so kind of talk about the fellowship with me. Is it 1 year? Is it 2 year? Is it project based, rotation based? What should our listeners know if they're interested in your organization? Where is it located?
Yeah, sure. So Luminous Health is actually a newer system. They were originally Anne Arundel Medical Center, and they acquired a community hospital and became Luminous Health. It's located in Annapolis, Maryland, and the fellowship, it was great. Honestly, like I loved it so much. It was more of a middle-sized organization, and that's one thing that I will say to a lot of listeners, because even my first year around, I wanted the big hospital names, but I feel like when you go into a middle-sized organization, you get more attention and focus on you and exposure to more things. So my like program director was the CEO of the hospital system, and then I also had a preceptor who was president of one of the hospitals. So it was so much exposure to like high level leadership, and I worked with both of their teams. So we worked in it with executive leadership. We ran their like weekly meetings, all the leadership like monthly meetings, but also at the department level, we were working with all the directors of the departments on different projects. So our fellowship was project based, which I thought was good, and it was 1 year. I think 2 years would have been a lot, but I like 1 year was like a good amount of time. But it was project based, and I liked it because I know for rotations, like I talked to a lot of my like colleagues and other like past fellows, and you're in a rotation for a couple of months, but you don't get to see a lot of your projects through. You get like 3 months in that project, and sometimes you want like a longer project. And being project based allowed me to work on a long project. Like one of my projects was like 6 months long, and I wouldn't have gotten that opportunity, a rotational based fellowship. But it was just great exposure to like high level leadership. I had a lot of mentorship, and they let us do whatever we want. Like we got out what we put in. And I moved out of state for the first time in my life, and I moved there just for this fellowship, so I wanted to get the most out of it. So I dedicated a lot of my time to that fellowship, and in return I got so many skills that I'm able to use in my current role. But yeah, I think that gave a good rundown of the fellowship.
Oh, absolutely. Yes, and you read my mind. That was gonna be my next question. If you had a co-fellow, so now that I know that you had one, was there opportunity for you and your co-fellow to do joint projects together, or was it mostly that you both kind of did your own thing?
So I would say system level, we both worked together, but then at the hospital level, we both had our own hospitals. So we worked on projects at like the hospital level. Some projects I did at his hospital, like he would help out with mine. Um, I would say the ones that we worked on together were more like system. For example, like doing the hospitals or the system community benefit report, like we worked on that together. So at the system level, we did work on projects together. But hospital level, they're like smaller and just for our hospital. So we work on those separately.
Yeah, awesome. That's awesome. And I know you touched on this a little bit in the previous question, but I think a huge reason why fellows actually do of the fellowship process is for the access, for the exposure, for the mentorship. And I know you mentioned that, you had access to the executives and the CEO, but can you talk a little bit more about what mentorship was like, with the various leaders at the hospital? And do you feel like you made lifelong mentorship connections as well?
I would say I definitely did. So our program director, she was the CEO, and I feel like when you're a fellow, I feel like you don't feel as important as like the leaders that you work with. But we met with her on a weekly basis, and we helped her so much. We were her right hand person. Whatever we needed, like she was always there for us, and she was very like chill. She was relaxed, so it was just like easy talking to her. So, and even when I was like looking for a job, usually like fellowships want you to stay within that hospital system, but my program director went above and beyond to get me like a job in New York, and like reached out to all her like connections, and I just like thought it was like so like considerate of her, even though I wasn't staying with that system. And then my preceptor was the president of one of the hospitals, and I sat like right outside her office, and she was so accessible. And even like when I was looking at jobs, going through interviews, having like a rough time because the job search is rough, even when I was going to that, it was just great. She had an open door policy, being able to walk in and just be like, "Hey, like I have this issue," and like they have so much, like they have a wealth of knowledge, and like they've been through a lot, so they just always have the right answer. So it's great. having those two resources. And then I had like an unofficial mentor, which was the COO of the hospital, and she was just great as well. Like I feel like I had a more like relaxed relationship with her, like because she was like my unofficial mentor. She still gave me like a majority of my projects, so it's nice having that connection with her. And again, like going through everything I did with the job search, all three of them were a great resource. So definitely mentorship. There's a lot there. And then I became close with all the directors as well in my hospital. I think everyone just loves the fellows. So then, they all were like so nice and welcoming and just wanted us to learn. So I love that.
Yeah, how incredible. And I heard you say she a lot of times, so it's so great to see female, leadership in hospital settings as well. So I'm so happy that you got that experience. And so in listening to you answer that last question, it seems like you did change your organization. So tell me more about where you are now, what your role is, and, maybe a project or something you want to highlight that you get to be a part of in your current role.
Yeah, sure. So I'm currently a project manager at Northwell Health, their children's hospital. So it's called Cohen's Children's Hospital. And I would say my role is like, there's like three parts to it. So like there's like an operational portion of it. So working on operational projects with our assistant vice president. And then there's a financial aspect of it as well. So helping all the AVPs as well as my manager who's a VP of like the ambulatory region, her with like the budget. And then also, I've been getting more into like physician comp and contracts and credentialing. So I started this role in July, so I'm still like getting my feet wet and learning everything. I would say one of the initiatives we're working on right now is like a same day stick initiative. So a lot of children, it's flu season, COVID. All the above, everything's going around. So we really want to, keep patients out of the ED, but also provide them the care that they need. Because, when your kid is sick that day, your immediate response is to bring them to an urgent care or the emergency room. But then that does like take up a lot of like space and time that isn't really necessary because that could be treated at one of the like general practices or primary care. So this initiative is to just get more patients scheduled like the same day that they are sick. So the same day sick. And it just helps us get patients like more access to care. We find a practice that's closest to them because our like region or ambulatory practices are all across like Long Island and Queens. We've been going to the city. So it's just like getting them an appointment as soon as possible with a provider that's closest to them. So it helps keep a lot of patients out of the ED, lower our ED volume, patient wait times, and just get those kids the care that they need at that time. So that's one of the projects we're working on.
How cool is that? And, I think lowering ED burden is 100% a really real issue across health systems across the country. So I completely understand why there would be an initiative to, get people the access and the care that they need, but then also making sure the health system is able to handle the volume of people that do come to the ED. So thank you for sharing that. And, I think one of the big questions that I like to ask all my guests, and I'll ask you as well, you highlighted this. The fellowship application process and being an early careerist can be daunting. It can be a challenging process to go through. So, if you were giving a fellow an advice, an applicant an advice as they go through, recruitment season, interview season has started, what is one thing you want them to remember as they go through this process?
I would definitely say like stepping out of your comfort zone. And I think I highlighted it before. Like, if I didn't leave New York, I wouldn't have gotten the experience that I needed. But that was such a big step for me because I've lived here like my entire life and moving to another state where you know absolutely nobody, like no family, no friends. It was such a, I would say, a rewarding experience, but also like daunting at first. But it made me like step out of my comfort zone and like learn so many personal skills. Like, I grew on a professional level, but also personal level. And to be honest, I don't think I would have gotten that experience here because a lot of the organizations that are in New York are already like well developed and like big systems. And I don't think I would have gotten that like here. So I'm glad I stepped out of my comfort zone and like left. But also, I knew myself enough to not take a fellowship just anywhere. Like, if I'm being honest, like I can't like I couldn't be in the Middle West. Like I need to be like near a city. I did get an offer in Pennsylvania, but it was like I remember like I do value like learning and my fellowship experience, but also I wanted to have a life out of fellowship. And I think work life balance is something that fellows should prioritize. So knowing yourself enough to pick up a fellowship at a location that you can see a life outside of work. That would be a big one.
Mhm.
I will say to be very vulnerable in your personal statement because, we actually had to we went through our fellowship applications for the next fellows that like took our place. And, they go through like over hundreds of applications. So to stick out, you just really want to be true to yourself, but vulnerable. Even like, they want to know you outside of work. So I mentioned like the wedding planning and event coordinating. At first, I was like, oh, they don't wanna know that, so I only talked about work, but then I got some, like, feedback from somebody that interviewed me, and when I told them I was, like, in the, like, wedding industry, they're like, "Oh, like, why didn't you mention that? That's so cool, like, we actually wanna know that you're a person outside of work." Like,
Yeah.
the people that interview, they're people too, so, like, just being, like you don't have to be as nervous, it obviously is a very nerve-wracking experience, but, like, yourself, being comfortable, and just, like, really knowing who you are, I would say that.
Yeah, absolutely. What incredible advice. And, I agree with all of it. Knowing your why is so, so important. And highlighting yourself outside of just your professional setting is so important. One thing I will kind of echo that you already said, and I also agree and always say this to any candidate is, you will be at work for a majority of the week, absolutely, but you will also leave work and you'll make friends and do community things within the city or town that you live in. So it's so important that you like the city or town where your fellowship is located. So thank you for highlighting that.
Yeah.
Um, and, with that, it has been such a great conversation with you. I just want to thank you for taking the time. I know it's late on the East Coast, so I just appreciate you taking the time tonight to speak with us. And I know this episode will bring, our listeners will be able to take a lot of good advice and hopefully even apply to your organizations.
Yeah, I hope so too. Thank you so much for this opportunity. It's been great. And also doing this podcast, like I wish I had more of this when I was applying. I don't think I had a lot of resources because my grad school didn't really offer that. So it's nice having podcasts like these or just resources to learn more about fellowships. But thank you again. It has been truly a pleasure.
Yeah, absolutely.